Open heart surgery, it's one of the most complex, high-stakes environments in all of medicine. You have a whole team of experts working for hours to repair the human heart. But what happens when all that complexity just becomes overwhelming? What's the safety net in a procedure this demanding? Well, the answer is surprisingly simple, and that's exactly what we're going to explore. Here's the key thing to understand about a place like an operating room. Errors are rarely just one person's fault. They happen when the entire system, the whole process, fails under immense pressure. The cognitive load, which is just the sheer amount of information everyone has to track at once, is absolutely enormous. And that, right there, is where the cracks in safety can start to appear. So that brings us to the really big question, right? When a surgical team is hours into a procedure, and every single person is laser focused on their own highly technical job, how do you make sure the big picture of patient safety never ever gets lost? How do you build a system that still works even when human memory is stretched to its absolute breaking point? Well, the answer, it turns out, is beautifully simple. It's a nurse-led framework, a really powerful cognitive tool that boils down hundreds of safety checks into just 3 unforgettable words. Now, this isn't just another checklist to tick off. Think of it more like a series of deliberate pause points that are designed to prevent that system failure we were just talking about. And what are those 3 words? They are ready, flow, and safe. It's brilliant, really. Each one corresponds to a critical phase of the surgery. You have ready for everything that happens before the operation, flow for during the operation, and safe for the handover after it's all done. So let's start at the very beginning, in those crucial moments before the surgery even begins. Okay, first up is ready. This checkpoint happens at maybe the most critical decision point of the entire day, right before the surgeon makes that first incision. This is it. This is the moment right before the point of no return, where you can still spot risks and deal with them before they become active, dangerous problems. And that question, it is not just a formality. This framework gives the nurse the explicit authority, the power to actually halt the entire procedure if the answer is no. It's the final safety gate, and it empowers a key member of the team to speak up and make absolutely sure everything has been verified before the whole team commits. So what does it actually take to be ready? Well, the R stands for Risk Profile Assessment. This means the team is actively checking for things like cardiac instability, a high risk of bleeding, any neurological vulnerabilities, or potential for infection. It's about making sure no surgery is ever just treated as routine. Next up, E and A are for equipment, access, and labs. This is all about the physical infrastructure of safety. Is there enough IV access? Are blood products physically in the room and double-checked? Are the baseline lab values exactly where they need to be? Because, as the source material puts it, no access equals no safety margin. It's as simple as that. And finally, to round out ready, D and Y cover drug safety and, crucially, U and team alignment. Have all the medications been reconciled to avoid a catastrophic error? And, just as important, is the entire team on the exact same page? Does everyone share the same mental model of the procedure and the risks? Because if you're misaligned before the first cut, you're setting yourself up for chaos later. All right, so once the team is officially ready, we move into the next checkpoint, flow. This one governs the intraoperative phase. Now, this is arguably the most dangerous part of the whole surgery. The patient's heart is stopped, and their life is literally in the hands of the cardiopulmonary bypass machine, which is doing all the work of the heart and lungs for them. During this phase, the core mission is incredibly clear and focused: protect perfusion, blood, and time. The nurse, in this case, acts as a safety observer, watching for all those subtle trends that a machine might miss. If the patient's flow is disturbed in any way, this framework empowers that nurse to be the very first person to speak up. So what does maintaining flow actually look like? Well, first, F and L cover flow, perfusion, lines, and leaks. Is that bypass machine flowing correctly? Are all the line connections totally secure to prevent a catastrophic hemorrhage, or even worse, a deadly air bubble from getting into the bloodstream? Is the team carefully tracking every drop of blood lost in the surgical field? The O is all about oxygenation and organ protection. See, every organ is vulnerable on bypass, but the brain and the kidneys are especially fragile. So nurses are proactively monitoring things like cerebral oxygenation and urine output to catch a problem before it causes irreversible damage.
This is about seeing a trend develop, not just waiting for some alarm to go off.
And finally, the W stands for one of the most critical factors of all: watch the clock. In cardiac surgery, time itself is a risk factor. Every single minute a patient is hooked up to that bypass machine, it multiplies the risk of major complications, things like inflammation, blood clotting problems, and organ dysfunction. The nurse's job is to be the timekeeper, making sure the team is always aware and working to minimize that exposure. So the surgery is done, the chest is closed. You'd think everyone could breathe a sigh of relief, right? Well, this brings us to a really crucial point and our final checkpoint: safe. The danger does not end when the surgery does. This immediate post-op period is filled with risk, and it's made even worse by the fact that the entire surgical team is exhausted. And to fight this risk, the framework has a very simple but incredibly powerful rule. The patient is not handed over to the ICU, period, until the operating room nurse explicitly declares them safe. This simple rule prevents rushed, sloppy transfers. It transforms the handover from just a casual conversation into a formal, structured patient safety event. Think of it this way: you have to take all of that intense, dynamic focus from inside the operating room and translate it into the calm, structured, data-driven assessment that's needed for a safe handover. The SAFE checklist makes sure that no critical information gets lost in translation when you're passing a patient from one exhausted team to another. So what does it take to get that SAFE declaration? Well, the S&A stand for stability and active bleeding surveillance. Is the patient's blood pressure stable without a ton of support? Is their heart in a safe rhythm? And crucially, is bleeding, which is the most common major complication, under control? And that requires systematic monitoring, not just a quick glance. And the final letters F and E are for function recovery and escalation. Here, the nurse assesses key organ systems to get a solid post-op baseline. And escalation refers to the handover itself. It's a structured event where any red flags, any concerns at all, are explicitly verbalized to the ICU team that's taking over. Nothing is assumed, and accountability is formally transferred. So, there you have it. Ready, flow, safe. We've seen what it is. But now let's just take a step back and really look at why. Why is this simple 3-word framework so incredibly powerful in such a ridiculously complex environment? Well, it really comes down to a few key things. First, its cognitive simplicity means it's unforgettable, even when you're under extreme stress. It's not some complicated protocol, it's 3 words. It also fits seamlessly into the way things are already done. But most importantly, it gives nurses the explicit authority to pause and question everything. And finally, its core ideas can be adapted to almost any clinical setting. And that really brings us to the final powerful message here. A framework like this fundamentally reframes the role of nursing. It's a huge shift from being a task assistant to being an active risk manager. The nurse becomes the safety architect for the entire procedure, checkpoint by checkpoint. So I'll leave you with this thought: ready, flow, safe. 3 words that create an incredible safety net in one of the most demanding settings you can possibly imagine. And that just makes you wonder, if a simple, memorable framework like this can make such a profound difference here, where else could it be applied? Where else could 3 simple words save a life?